we're all at the moment coming to terms with the loss of physical touch, and for these women that's their lived experience until they get cured.
From Mamamia, I'm Mia Friedman and you're listening to No Filter. Having a baby is really hard, the actual giving birth part. And if everything goes well, it's still exhausting and emotional and a massive deal. If everything doesn't go well, if you have a difficult or prolonged labour, if you have complications, or heaven forbid you have a stillborn baby, it's devastating. Imagine if that happened to you and things didn't go well, and afterwards you were ousted from your community due to an embarrassing medical issue that you were left with because of the labour and because of the birth. It's not even a big issue. It's like a small operation can fix it. But you don't know that, and your community doesn't know that. And so you're forced to live out your days deep in grief, banished to a little hut, abandoned by everyone you love. Dr. Catherine Hamlin wasn't having a bar of that. She knew that she could change the lives of young women and girls, and they were often as young as 13, who were afflicted with this condition after giving birth. And she decided that she was going to change their lives. And she did. Thousands of them. Along with her husband, Reg, Catherine Hamlin made it her mission to save the girls and the young women of Ethiopia, starting a hospital that was dedicated to that very thing. And we were only a few weeks into peak coronavirus crisis when the sad news came from Ethiopia that Catherine Hamlin had died at her beloved hospital, peacefully, at the age of 93, surrounded by many of the women whose lives she changed. We didn't want her extraordinary life to pass without being acknowledged here at Mamamia and No Filter. She was actually known as a saint across Ethiopia, where she lived since the 60s. And her funeral was attended by the Ethiopian president and the prime minister, despite the fact that they were in the middle of the COVID-19 crisis. Joining me on No Filter today to tell the story of Catherine Hamlin is her niece, Alison Morgan. She was so inspired by the work of Catherine that she too became a doctor in women's health, and she actually spent some time at Catherine's hospital watching her aunt work. Here's Alison, and through her, a bit of Catherine Hamlin's spirit.
Alison, tell me the last time that you saw your Aunt Catherine. Can you remember when it was?
Yes, I was in Addis Ababa in November last year. I was doing some work for UNICEF and spent 2 weeks. So I went and visited her in the hospital then. And so just November last year was the last time we got together.
Tell me a little bit about what you saw and experienced when you were there. How was she?
Look, she has been quite frail the last few years, and when I first went to the hospital, I was showing some friends around because the work is so extraordinary, and they said, oh, no, she's having a rest, come back this afternoon. And so I came back that afternoon and she was walking through her garden. She does that a couple of times a day, beautiful gardens that she's really established over many years, with two of her very close friends, a nurse from the hospital and Mamiti, who is really like a daughter to her, is a fistula surgeon in her own right, but is also an ex-patient. Extraordinary story on its own. So Cath was walking with Mamiti and this other nurse whose name I can't remember, and the care was amazing because she was walking and then having a rest. So someone was bringing a chair so she could just sit and enjoy the garden and then walk back. And then we went down to her home, her house that they built in the 70s, mud brick. I remember Cath telling the story that they didn't have any plans. The builder was illiterate, so they just had a big rug, and they said, build the living room a metre on each side of the rug, and that's the size of the living room, and then the dining room is the same. But in that house where lots of people have visited and had a beautiful cupboard, we had coffee and biscuits and had a chat, and so that was really special.
What took her to Ethiopia in the first place? How did her work in Africa begin?
She went on a 3-year contract with her husband Reg in 1959. So caution to anybody that takes a 3-year contract anywhere, it might turn into 60 plus. They had been working first in Sydney and then they'd worked in the UK and they were in Adelaide when they saw the ad advertised in the Lancet, and they thought, oh, well, we've got all these skills, we've had this very privileged opportunities ourselves, let's do something in return, I guess, was a very big driving force. So they thought, well, that would be an opportunity to take up, applied, got accepted, and, the rest is history.
What was that initial job actually for?
The initial job was to set up a midwifery school in the Princess Sahai Memorial Hospital in Addis Ababa. That hospital had been started actually by Sylvia Pankhurst, Emily Pankhurst's daughter, who was a great friend of Ethiopia and who met Kath and Reg the night they arrived. But so they had set up this hospital and they wanted to start a midwifery school. They had good nurses there who'd been, but no actual cadre of midwives. And so the job was to help set that up. They also, which they did do, and in fact, Maggie Miles, any midwife who's listening would know this classic textbook. She actually came out from the UK to help them set it up and teach for the first 6 months and design the curriculum. So that was their job. But at the same time, they were also working as obstetricians and gynecologists at the hospital, and it was through that work that they started meeting women who'd experienced an obstetric fistula.
What was does she remember or do you remember the first sort of fistula she encountered, and why is that something that she probably had never encountered before in sort of first world medicine?
That's right. So they'd never seen one in Australia. And in fact, the gynecologist that handed over to them had sort of, I guess, prepared them a bit, because one of the things that she said was the fistula patients will break your heart, because at that time treatment was not really available, and a lot of surgeons, very few surgeons were actually doing fistula surgery. There's a lot of complexity in some of the fistula cases. So they had heard that this is likely to, that they would encounter this problem. But the first woman they encountered, I think it was at the end of the first week, and they write about it in the book that Catherine wrote, The Hospital by the River. At the end of their first week of working, they met their first woman, a young teenage woman. She'd been in first baby, had been in labour for days, and the baby had died. And then when the baby had died, the baby was delivered. Often after the stillbirth, the bone softened, so if there was an obstruction, the baby can be born. And then this woman found that she was leaking non-stop, leaking urine. So when she arrived at the hospital, she was in clothes that were just soaked in urine, very difficult, really smelly, offensive. No one wanted to be near her. In the outpatients, she was sitting separate, very embarrassed, really ashamed. And Reg and Kath I think Reg was the first person and just said, oh, you're the most important person in this outpatients clinic, and brought her in. And I think that, Catherine always used to say, if you meet one woman who has experienced this, you can't not have your heart really touched and want to do absolutely everything, because, they've been through an excruciating labour, lost a baby, then find they're sort of incontinent. And then, the social isolation consequences, often their families, their husbands will divorce them, or they're put into a hut in a field. They can do field work and that's about it. So, we're all at the moment coming to terms with the loss of physical touch, and for these women, that's their lived experience until they get cured. So, that then started a fascination of, well, can we actually, what can we do and how can we treat them? They looked up books. They wrote to surgeons. There was a couple of surgeons, one in Germany, one in Egypt, that they wrote to. The textbooks were from, I think, the 1900s. Then one did come out. So, it's an extraordinary, I think always it had been in the sort of too hard basket, especially in low-income countries where there's so many other immediate problems to address, something that requires some complex surgical repair was just always seen as too hard.
What actually is fistula?
Fistula just means a hole. An obstetric fistula occurs if you imagine, babies are born head first, and if there's an obstruction, the baby's head will press onto the tissues of the vagina. And if they're pressing there relentlessly, they cut off the blood flow, a bit like tying a piece of string around your finger. And so for obstructed labour, whereas in Australia, if that happens, you would have a caesarean section, and so relieve the obstruction and deliver the baby, and the baby and the mother would be fine. Where women can't get access to that sort of care, they will labour for many women, the story is for days. So you've got this pressure on the vaginal wall, those soft tissues, for days, cutting off the blood supply. So eventually when they do give birth, that tissue has basically died and sloughs off and leaves a hole between the bladder and the vagina. And for quite 10% or so of the women, they might also have a similar hole between the vagina and the rectum. So there's no then control over urine or feces. It just is a constant leakage. Unimaginable.
And you touched on if left untreated, what happens to these women in their villages, even amongst their own families?
Yeah, that's right. I mean, I think you can imagine often the women will tell the story that they wake up from the horror of this incredibly difficult birth, grieving over losing their child, and then they suddenly find that the bed's wet and they think, oh, what's this? And, they might lie really still hoping that, over days it might heal itself, and then that dawning realisation that this is not getting any better, it's unchanged. And they might eat less or drink less. So a lot of the women become quite poorly nourished. Some women have been in a position where they get really severe wasting. There are some women for whom the pressure not only creates a fistula but causes pressure on the nerves, so they get what we call a foot drop, so that, walking is challenging. So there are a number of complications. And then, as you can imagine, the risk of a urinary tract infection, if you've got this fistula, is quite high. So often some of the women will start getting recurrent infections, and that will create scarring. So the longer between the fistula occurring and the repair, the likelihood of more medical complications like scarring and urinary and bladder problems, and, of course, the social complications are really compounded, the mental health consequences, the social consequences. Women have got absolutely nothing, incredibly challenging.
The average Ethiopian woman, I've heard you say, gives birth to 6 children. I think that's down to 4 now.
That's right.
But over the time that Catherine was working in Ethiopia, the population went from 20 million to 80 million. And how old are women generally when they're giving birth? And is that part of the reason that these births often go so horribly wrong?
Yeah, it's a really interesting question. There's a couple of thoughts about whether fistula is related to very early birth. I think culturally in Ethiopia, women tend to marry early, and the fistula tends to occur with the first birth, because if there's some reason for the obstruction, it will happen the first time the women get pregnant. So you often then find that many of the women with a fistula are very young. And then, so the question is it because they're young mothers that they cause fistula, or is it just because young mothers are having their first baby and that's highlighting the obstruction? My thinking is that it's probably the fact that culturally they're having their first baby young and that's highlighting the fistula, simply because generally there are lots of risks around early birthing. Adolescent mothers have a much higher risk and their babies have much higher risk of dying. So there are significant risks. But when we looked at the age of the fistula occurring at the hospital, we did a bit of a study a while ago, and the average age was around 22. So it sort of belied that. the opposite challenge of that is that maybe people don't really record their age very well, and they might think, oh, well, so the veracity of people's reporting of their own age is probably not very strong. I think what is often the case in countries like Ethiopia is that you have, firstly, when Catherine and Reg were there, the access to a hospital for a birth was the average woman lived 10 hours walk from a road. Then you would have to wait for a bus to get to the town where there might be a hospital. So most women would deliver at home, and then you think, well, the labour's gone on for this long, it's nighttime, I'll wait till the morning. It might. So that decision-making about when to seek care is really challenging.
So how did things develop from seeing that first patient that Reg and Catherine saw to, this incredible hospital and helping so many women?
The first patients that they saw, that just their situation really drew them in, and they looked up how to do the actual surgery. They had a few women come in, and in fact, Reg learnt that, the nursing staff were loath to, they're incontinent. It's very difficult nursing challenges, you can imagine. So they'd often discourage the women from coming in. The women would often sit in the garden of the hospital and not wanting to come in. This was when they were still working at the Princess Tahai Memorial Hospital. So Reg would make a habit of going around outside of the hospital to find women who were too shy or had been put off coming in. They got permission from the hospital to have a few dedicated beds for fistula patients, and then they looked up how to do the surgery, and they had one woman with a very simple initial, a smaller fistula that they thought, they could repair this, and sure enough, she was cured. And I think that was the magic. It's like bringing somebody back to life. So then they started.
How was her life changed by that surgery?
Well, I think one of the things I often say about the work that in my work as maternal health area, that they recognised the holistic approach to care well before, we talk about patient-centred care now. They were doing it 60 years ago. The surgical cure is just one aspect of it. I think a lot of the other care was the fact that, Reg would make a point of touching the patient, when no one had come near them. So Cath would sit down in the outpatients and just have her arm on the woman, talking her through what had happened. And in their ward rounds, they'd go around and they'd make sure they, heard everybody's story, talk them through. Everybody had an extraordinary story, obviously, to get to the Fistula Hospital. And then when they were cured, they, would drive them down to the bus station, give them their bus fare home, give them a brand new dress, say, and then they'd tell the women an amazing story, give them a vision, and they'd say, I want you to imagine this. You get off the bus and you're walking down to your village, and all your family and your village will look up and they'll say, who's this beautiful woman walking down here? Who can it be? She's in this beautiful dress. Who is it? And then they'll suddenly realise it's you, and what a big party they'll throw for you. This sort of giving women hope who had none. And then they would say, we want you to, if get married if they'd been divorced by their first husband, and then when you're pregnant, when you feel the baby walking inside you, you walk back to us. You start walking to us, and then we'll deliver you a live baby for your next pregnancy. So I think that extension from, the whole care was quite phenomenal. And then word got out that they were doing this surgery and that they were getting successful repairs. And so then people started sending other patients to them, other women would turn up. So they had a few beds in the hospital, but more patients than they had beds available. So their first step was to get permission to build a hostel for women who were waiting for those beds in the Princess Sahai Hospital. So they had a hostel waiting for women. It was also good for women who needed to have their nutrition built up or some physio before surgery. But, they got to the point where they had 60 women in the hostel waiting for these beds, and that was when they thought, we really need to build a dedicated hospital. And so that happened. That realisation happened in, the late 60s, early 70s, and in 1974 they opened the Addis Ababa Fistula Hospital.
What kind of hardship did the women have to experience to actually get to the clinic? How did they get there and how did they hear about it? Was it just sort of via the grapevine? I mean...
Yeah, there's a whole range of different strategies, and I think they've got really clever in some of the ways they try and find women. Firstly, it was word of mouth, and there were, dotted little clinics and mission hospitals and through the country, and they would hear and then start referring and sending women. There are some pretty heartbreaking stories. One woman on the Kenyan border with Ethiopia, she had been identified as having a fistula. It was a fairly simple, straightforward one, and was sitting there and had been referred, so had a letter. And then when she arrived at the hospital, they looked at the letter and it was dated 7 years before. And they said, how come it took you 7 years? She said, it took me that long to beg for the bus fare.
Oh, wow.
And you just think, oh, my goodness. And so there were there was word of mouth. Then they started doing, they'd put out messages on the radio. Currently they do a very clever thing where when they're doing a polio campaign, which, involves house-to-house immunisation campaigns, they'll, ask questions about if anybody, has incontinence and had they recently had a birth, and try and identify women that way. So there's a lot of active case finding now. There's still probably quite a number, probably a few thousand women in the country who have untreated fistula. So, but there are still some very remote pockets in Ethiopia that, that it's hard to actually get the message out to everybody.
They say that shame can't exist where there's empathy, because these women, I imagine, that turned up at the hospital were experiencing the double trauma of their birth and their labour. And does every baby die during a fistula case?
No, the majority they do, but there are some who deliver a live baby. So that'll be lovely, because in the ward, there might be a few children, babies with the parents, but the vast majority, I think it's around 80 to 90% will, the fistula will occur following a stillbirth.
So there's the trauma of experiencing that, which is almost unimaginable. And then there's the shame of being cast out. I mean, anyone in our society who experiences that kind of trauma in a birth situation is enveloped by empathy and love and care and support. And to think of these women being cast out, often literally cast out of their communities and being sent to live in a little hut where someone comes and brings them food. How do you untangle the knot of that shame and the grief and trauma of these incredibly vulnerable women?
I think you have to experience the reverse to mitigate that. For a lot of the women, and, I have to be upfront here, I've visited the hospital a few times. I spent a medical elective there many years ago, but I haven't worked there. What you hear from the women is that the sense that I'm not alone and that I'm not the only person that's experienced this is a very powerful thing. So when women arrive and they suddenly see other women, they see women getting better, they see the joy and the party, the send-off that women who are discharged, going home, all of that is incredibly, a revelation in its own, because I think one of the defining characteristics is this incredible loneliness that is part of this, that you feel God has somehow cursed you and that you are the only person to have ever experienced this. And then I think following that, it's just the fact that suddenly there is a lot of love, there's a lot of fun, there's laughter, there's singing, and then there's the prospect of cure. The hospital is extraordinarily clean. And I think when I was first there in 1982, and it was my first time overseas. I didn't really realise how extraordinary that was until later when I worked in lots of other different hospitals around the world in low-income settings. At that time it was 40 patients and they were all incontinent and you could not smell urine, which is just gobsmacking. So the fact
in
that
a third world country hospital.
Yeah, that's right. So it was beautiful, light and airy, regularly, obviously clean very well, and just a really beautiful place.
Are any of the women that you met indelibly imprinted in your mind and your heart? Can you remember any particular stories that have stood out over the years to you?
I think the story of Mamitu is one of the best. And I met her first in 1982 when I was there as a medical student. And Mamitu had come to the hospital, I think age 16. This is before the Fistula Hospital was built, so very early on in when the work was being done out of the Princess Sahai Memorial Hospital. And she had, quite extensive injuries after a very difficult first birth. And she stayed at the hospital. I think she needed quite a lot of recurrent care, and it was difficult to get a complete cure for her. So going back to her village wasn't really a good idea because of the risks of, infection. She stayed and then started helping out. First, she was just helping out in the ward. Then she would start helping out in the theatre. She learnt to read. Then she started helping in she was doing the sterilising equipment, and then she started helping in the theatre, assisting both Reg and Cath in their operations. Eventually she was doing them on her own, and she was given, cited by the Royal College of Obstetricians and Surgeons, I think given an honorary fellowship by the College of Surgeons in the UK in recognition that she is a world-renowned fistula surgeon in her own right now.
Wow. That's incredible.
It is an amazing story. She is, she has retired now herself. She, in her 70s, was with Cath last week or 2 weeks ago when Cath passed away, is like a daughter to them, spent every day, would visit every day. But yeah, so from a 16-year-old village woman to a world-class fistula surgeon, that's a pretty extraordinary story.
Can you tell me a little bit about what the lives for Ethiopian women are like, just in general? Paint me a little bit of a picture about, even without fistula, how does the country sort of view women and their place in the world?
Ethiopia now, has over 100 million people. It's rapidly developing and changing significantly. So when Cath and Reg first went there in 1959, it was, overwhelmingly rural communities, farming, subsistence farming largely, and women would get married very young. They'd often be betrothed in their, very early teens, and then go and live with their husband's family. And then, they would be helping in, caring for animals, the field work. And then when it came time to, have a baby, that would be done at home with the support of the local community. And, it was that sense that you'd take your chances with childbirth. It is a fairly patriarchal society, although I think that has changed significantly, and I would be the last to say I'm a real expert in Ethiopian culture. I've mainly done my work in other parts of the world. There are pockets where women are, particularly in the very north of the country, the Afar region, which, semi-nomadic pastoralist women, where we've done quite a bit of work. There is a lot of women are very much viewed as a possession or a very different status to men. In fact, in some parts of some communities, the loss of a camel is a much greater disaster than the loss of a child or perhaps a wife. Although, that is changing. So the picture from 60 years ago and the picture now is vastly different.
How was Catherine viewed there? A white woman from Australia coming to Ethiopia. She was quite a young woman when she came there and dedicating her life to help young Ethiopian women. How was she viewed?
She is viewed as somewhat of a saint, which would make her giggle. Last year, I was teaching a course for UNICEF, and one of the participants was an Ethiopian doctor, and he was just gobsmacked. He said, Catherine delivered me. She taught me obstetrics. He was just raving about how incredible she was. A friend of mine was in a taxi in Sydney, and the taxi driver was an Ethiopian, and my friend just said, I have a friend whose, aunt is Catherine Hamlin. And the taxi driver stopped the taxi, rang his family, said, I've got someone in the car who knows someone who knows. I'm like, how many degrees of separation was that? But the taxi driver was just gobsmacked because he held her in such high regard. So you do get.
So she's
this
like Beyonce, basically, in Ethiopia.
Yeah, that's right. Indeed.
Beyonce meets Oprah.
That's right.
I wanted to ask you about her and Reg because, it's a love story for the ages. They're obviously very aligned in their desire to give back. As you say, Catherine had a very privileged upbringing and they didn't choose the easy life. They chose a hard life to go and help other people in Ethiopia and then to stay. She was always kind of the star, right? Like in there, it was always, they worked together very much, but I'm interested in the dynamic of their marriage.
Oh, I'm not sure I can, how much I really know as someone who visited and saw them, when they visited Australia each year. I think Cath would say that Reg was the driving force of the fistula work. I think, he was really, really taken with what these women had to endure. But it's interesting, the development of the work and the maturity and the growth out to prevention and rural care all happened in the last 20 years after Reg passed away. So Cath would attribute it all to Reg, but I don't think that's true. Their relationship was just an absolute partnership from the word get-go. And I remember, Cath was she was quite the social one. Reg would say, why would you stuff up a social engagement with eating? He was quite sociable, but he was very happy also to stay at home, whereas Catherine enjoyed all of the social events around Addis Ababa, would go out visiting and when she could, and she was probably a driving force in their connectedness. But again, I might be a bit distant from knowing really the intricacies of their relationship. They were both extraordinary storytellers. They would play off each other. So meal times were hilarious because they'd tell one story and they would get more and more exaggerated. And, it was very good laugh to be with them.
They had one child together. Did they already have that little boy when they moved to Ethiopia, or was he born over there?
No, Richard was born here. I think he was about 6 when they went to Ethiopia. So Richard grew up in Addis and didn't leave until the last couple of years of high school. There wasn't really schooling then in Addis for the A-level. So he went to the UK for his final 2 years of school.
Did they ever think of coming back to Australia?
I don't think so. Once the first few years had, even their first visit back, I think, they write that we were returning, there was no question. And then I think that the work became very absorbing, setting up the hospital. And, they were doing this through the downfall of Haile Selassie, this sort of regime, the Derg regime, with its, there was a really horrendous Red Terror episode in there, and they just stuck through it. I think they felt very loyal to keeping the work going. Cath, I think when Reg passed away in 1993, I think that was a real time of thinking, oh, what do I do now? She was, I think, 69 then, thinking, will I come home? A lot of people are retired by 69, and in actual fact then had this incredibly rich 20-year or more period after that of developing the work. I think she did her last surgery at 89. She said that as long as her hands didn't shake, she could keep going. To say the idea of a 90-year-old operating is a bit daunting, but, she a bit of a star, I think, that she did stop then.
And how did you get to know Cath as your aunt, as a woman?
Well, at first they would come out every 3 years, and at that time, there was lots of family events and things like, Cath loved to surf, so we'd often go to the beach together. But that was in the amongst of Cath, my father's her brother, and there's 6 in that family. So there's a bit of, quite a number of cousins, and we'd all hang off these stories and hear what was going on. I remember when I was about 10 and they were out in Sydney, and she said, what does an aunt say to some niece who's a bit sort of open-mouthed and goggle-eyed? I said, Alison, what do you want to do when you grow up? I didn't really want to grow up, I don't think. Anyway, I just said, I really want to travel, and I haven't made up my mind whether to be an air stewardess or a doctor and work overseas like you. And quick as a wink, Cath said, if you're an air hostess, you have to clean up vomit. I said, okay, well, I won't do that then. I'll be a doctor like you instead. But, I didn't really know very well. And then as a medical student, I went over there in 1982 and lived in the hospital grounds, there was this little traditional Ethiopia tukul, which was the guest accommodation. And then I'd go down and spend, all my meals and evenings and time with them. And that's when I think I got to know her a lot better. And as a young adult, here was this woman who was, extraordinary and had met, the Queen and the Emperor Haile Selassie and all of these people, and yet was really interested in this nobody of a medical student from Sydney. And that was, I was quite struck by her incredible openness. I found I could talk to her in a way I couldn't talk to my mother, for instance, and that was, a very seminal thing, I think, in my formation, that we could talk about anything and everything. There was no topic off the table, and that was just really liberating, I think. She was very forthright. She'd say what she thinks. She'd tell you if she thought what you said was really stupid. But that openness was a very powerful influence on me. And then she was quite a letter writer. So she would write every week to her mother. And then when my grandmother passed away, she would write every week to her sisters. And she would write to, random nieces like me. That level of interest in the midst of everything that they're actually developing and doing there was really powerful.
She's often described as a saint, but I've heard you talk about the fact that she was also a rebel, and she had to be.
Yeah, she was quite conservative and conformist on a whole lot of, she was a great monarchist. She, loved the Liberal Party, although that changed when our approach to refugees, she was appalled at. I remember having quite a discussion with her a few years ago about that. So on one level, she was, very conservative in a lot of her views, but in other ways, she was incredibly out there and nonconformist. So this very strong advocate for women and the fact that women could do anything and be anything, which, growing up, in the 1920s was quite out there.
So she was such a feminist way before that word was even really used.
That's right. Indeed. And she was also in the family the rebellious one. So her older sister Sheila and my father, the next child down, Peter, were probably very good and did what they told, and Cath would never, she would always question the rationale for anything before being very compliant. So if anybody was getting smacked in the household, it would be Catherine. If anyone was leading a sort of activities, it would be Catherine. So, she was, that had been part of who she was always.
She had spirit.
She did.
How was her death greeted in Ethiopia when it happened a few weeks ago?
Well, as you can imagine, in the midst of all of the restrictions, it's been really hard to I guess, allow everybody to grieve and mourn her in the way that they would have otherwise. So obviously everyone in the hospital is just really devastated. But what they did is they set up the car park, the front area, as a big marquee with very well-spaced chairs and a whole lot of, a photo of Cath. There's a big statue of Cath and Reg at the hospital that was commissioned and created for the 60th anniversary of their work there, which was inaugurated last year. There was the 60-year mark. So beneath that there are, photos of Catherine and a memorial book. And then people over the following 3 days after she passed away would come and, write their memories. So the photo, because none of the family could go across, obviously, but the photos from that are beautiful, with people spaced in the chairs far apart from each other, big bottle of hand sanitizer beside the book. But, the president of Ethiopia went and wrote in there. The prime minister went and wrote in there. All of, the embassy dignitaries and then the women of the hospital, the photos of them singing and mourning her are very moving. Yeah, very sad. And then on Monday last, they had the funeral, the service in the church.
What a fitting send-off, as much as it could be in these weird times. And is she buried there? Is that where she's going to remain with Reg?
That's right. So with Reg, yes. I'd need to look up the cemetery but it was where Reg was buried 25 years ago.
Alison, I'm so sorry for the loss of your aunt, and I'm also so envious that you got to have the experience of being her niece. Thank you so much for taking the time to share your memories of what an extraordinary woman.
Thank you. Yeah, no, I'm very privileged to have had her in my life. I will miss her even at the distance, but definitely she's touched a lot of people, even those that never got to meet her, and it's good to be able to talk it through. So thanks for the opportunity to share some very precious memories of her too.
That was Dr. Alison Morgan, who was talking about the life and work of her beloved auntie, Catherine Hamlin, a hero, a true hero. If you'd like to support the incredible work Hamlin Fistula continues to do, go to hamlin.org.au, and you can also pay tribute to Dr. Hamlin at rememberingcatherine.com.au. If you've enjoyed your time out with No Filter today, remember that there is a whole bank of episodes that we've recorded previously in your feed. And for another week or so, we are also dropping a little baby No Filter each week on a Thursday to keep you company through the crisis. And this week, Amanda Gordon, who's a clinical psychologist, will be joining us to talk about anxiety. What's the difference between stress and proper anxiety? How to know if it's temporary or whether you actually need professional help? And what are some of the things that we can do to treat anxiety? Stay safe, travel well between your bedroom, lounge room and bathroom. I'll be back with you soon. Lots of love.